Hello, everyone, and welcome to Revive Health's Daily Briefing Live for April 23rd, our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. I'm Jeff Spear, your guest host for today and tomorrow's podcast. As always, we're joined by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. He makes everything happen. Hey, Chase, how you doing?
Hey, Jeff. Good to see you.
You too. Today we're also joined by Ryan Coliani. Ryan's a Senior Vice President, Issues Crisis Department Lead here at Revive Health and a frequent guest on the Daily Briefing Live. How you doing, Ryan?
Doing well. Thanks for having me back.
Thanks for coming. And today we're going to talk to Ryan about, as we get into things, kind of the next phase of what our communications teams have to be thinking about and issues we can manage to hopefully prevent the crisis as always our jobs. But before that, we'll cover a couple things. So this is when I get to talk about our disclaimers and things. As with each show, we'll plan on covering the latest news and how it relates to marketing communications. We're going to highlight some resources and share what we're seeing and hearing from Marcom professionals across the country. Ryan particularly has a lot of really good insights. He really is serving as a expert in the hub of the spokes across our agency, talking to everybody and many of our clients. As we move through the show, please use the question queue in Zoom to line up your questions, and we'll get to many of them as possible. You can also use the chat function to talk to other attendees, but please keep in mind if you'd like us to answer a question, use the question queue only. We've also provided any relevant links in the chat, and you can access those immediately. Chase will be populating that chat function throughout the show. And of course, if you have any questions later, just check in with us. Finally, you can subscribe to the podcast on iTunes, search for Revive Health Daily Briefing Live. We'll also be posting and recording the episode by the end of today on our communications hub, www.thinkrevivehealth.com/COVID-19. For other content as well. Two more important notes. We are not experts on COVID-19, so this is not a place to come for medical or scientific advice or resources. And we do have opinions, lots of them, on how you might want to manage this crisis. But everyone's situation is unique. And in the end, we know you got to make the decisions that are best for you. All right, let's begin. I think I hit them all, right, Chase?
You got him. Nice work.
Yeah, the bar for me is low. All right, here we go. We always start with the latest count in using the Johns Hopkins tool to see how the crisis is growing and hopefully receding. So today, as of right now, Johns Hopkins tool says we're at across the globe 2,665,000 cases confirmed, and in the U.S. that's 843,981. Total deaths are at 46,972. And we have now conducted almost 4.5 million tests in the US, which we know is really, really important, and we need to have more. The daily cases, I'm looking at a tool, does seem to be declining slightly. But there's some peaks and valleys in there in March, and we know every region is different. So just sharing that, keep things in perspective for us as we talk about marketing communications. We know it's important, but the context in which we're living is more important. Okay, let's talk about some daily news today and some things that are on our minds. Chase and Ryan and I have been talking about several different things over the past couple of days, but one thing that is now getting to national news and regional news certainly is states starting to open things up. Tennessee is, Georgia is, Louisiana is thinking about it, and part of that is important part of keeping things hopefully somewhat controlled is contact tracing. We saw a couple articles today. Ryan, you mentioned a couple about some of the technology and tools that might be available for states in contact tracing. Can you talk a little bit about that?
Yeah, I mean, I'm sure folks on the call here have seen some of the new coverage out in the last week or two that pointed to Google and Apple combining forces on potential contact tracing technologies. There was a new article out today that Microsoft is actually partnering with the University of Washington Medical Center on an app, and essentially kind of how these apps will work is you opt in, you share if you have tested positive for COVID, and then they'll use Bluetooth technology to alert others to determine if you have been in contact with that person who tested positive. And so knowing how important contact tracing is going to be until we have a vaccine, this is incredibly relevant for health systems and kind of how they communicate about these apps.
And there's also, of course, the human element. Every state is now trying to figure out how they ramp up their human contact tracers, and public health departments in most states are not equipped to do this as is. They've got to hire people in really, I think there's a couple things to think about there, but one of them certainly is, well, what is the role of a health system right now as it relates to contact tracing and supporting that? What do you think, Ryan? What things come to mind for you?
Yeah, I mean, I think there's a couple of things that we can go to, both on the physical contact tracing as well as kind of the apps. On the physical side, obviously, given the financial strain that a lot of health systems have faced over the last couple of months, given COVID, is there an opportunity to partner with state public health organizations and health agencies to share some of those employees that may be furloughed right now, may not be getting the hours that they typically expect, to kind of be some of those physical contact tracers? Have them be the ones to ask the questions. They're already well versed in the healthcare system, and that ultimately could be an opportunity. On the app side, when COVID first approached, a lot of health systems were repositioning their existing creative buys to focus more on how the public needs to stay safe, things like washing hands, social distancing,
Right.
those types of things. I could easily see health systems transitioning some of that PSA style approaches to talk about the need for the general public to opt in and use these contact tracing apps to help flatten the curve and lower the death rate and the infection rate.
That's interesting, because there's a part of that where, as a health system now, you are advocating for somebody to give up a little bit of their privacy, depending on the state, but maybe not. I think everywhere that could be a sensitive topic, but some states and some regions may be more sensitive. So every communication team needs to really dissect that carefully and come up with the right messages and make sure that their teams understand the technology and the privacy issues. You'd said earlier that that privacy supposedly is kept on the device. Is that right? On at least some apps?
Yeah, it seems like most of the apps are keeping it on the device and aren't going back to the developer like Google or Apple or Microsoft. So hopefully those will alleviate some of the concerns that you're talking about. And I think you're absolutely right. Just as we talk about the importance of HIPAA across health systems, I think talking to our employees and to our patients about how important privacy is will be important. But I think there's also an opportunity to talk to people about how they can do their part to help lower the curve, how everybody still has a role in solving this crisis, and this could be a way to do it. So it may not be a fit for every health system, and it probably needs to wait a little bit until the technology is really ready to go, since these apps are, the Microsoft one, I think, is just launched today. So we still have a little bit more time to see, where people may use them and how they will use them, but it's something to start planning for from a health system marketing perspective.
Yeah, and I think that the other element that it's really important to think about is, how can you support your local public health department in contact tracing? On those campaigns, the PSA style campaigns, are you working with your public health department to say, how can people be more aware even before they know they have the virus, so that if they do get the virus, they can provide the right information to people? That might be part of it. Just maybe it's simple daily tracing of your activities, a little journal, or maybe it's just in making sure that you contact somebody right away. The other part of that, I think, is most health systems in the country, there isn't a great connection with state health departments. I'm sure right now they're working more closely together than ever. But if you're not doing that, really establishing relationships and connections for public communication and operational things. What can your staff be doing to support all the new contact tracers that are going to be hired, and really needing and required to develop relationships with consumers in order to gain their trust so that they can understand who they've talked to and what they've been doing. Those are skills and techniques that most nurses and healthcare workers have learned and are really, really good at, and may possibly be able to support, as Ryan said earlier, support public health departments, or at least help give them some intelligence and training. Well, that, I think, is a really good example of what we wanted to spend most of today talking with Ryan about in the episode, which is, okay, maybe a lot of our listeners have gotten through a 4 to 6 weeks kind of crisis. It is absolutely a crisis, and might be taking a breath now, as we all should. I know that everybody's kind of feeling, this is 6 weeks will be tomorrow for me for being at home in the pandemic, and there's definitely a breath that's getting taken. But on the business and what we're doing in our jobs, things are starting to maybe feel like in some areas there isn't going to be a surge where you're not going to have capacity. Maybe the PPE situation in your hospital is fine now, and it's natural to want to take a breath. But what should our listeners be doing during this time? So Ryan's here to really talk through some of the things that our Issues Crisis team and he have been seeing what's ahead and what we should be thinking about.
Yeah. So kind of the first one that we're seeing is, obviously, as Jeff just mentioned, most health systems, or all health systems, just went through or are in the middle of the most significant health crisis that they've faced in their lifetimes, and hopefully will ever face again. And so one thing that we're working closely with health systems on are kind of taking stock of how we performed from a communications and marketing perspective within this first wave. So reviewing crisis playbooks, making revisions, conducting assessments to determine, how well did we respond? What worked, what didn't, and what should be enhanced? Where did bottlenecks and approvals occur? Where did we miss from a response perspective? It's critical to do this in the moments after you've gone through the crisis, so that it's fresh and that so you really have kind of an honest assessment. And for some health systems, they may only have operational crisis playbooks, and this ultimately is an opportunity to think through, what does a communications crisis playbook look like in advance of potentially a wave 2, or heaven forbid a wave 3. So that helps kind of ensure that leadership know what roles they're supposed to play. It helps ensure that the communications and marketing teams knows exactly what role they're going to play, and so that we can rapidly respond to the various issues that may be arising as part of the end of wave 1, but also into potentially wave 2 in the fall.
There are multiple things that come to mind right now in that playbook that you'd want to examine to see how you did and what adjustments to make, because hopefully you have a playbook, but if you don't, you need one. It shortchanges things. It makes decision making much faster. And right now, it'll be so effective to create those scenarios and decision trees for wave 2. But there are other things like, how did you do when it came to communicating with supply chain management and operations? Or did your team know how to media train somebody and who the spokespeople were, and having guidelines and talking points drafted? And then for some teams, if you had to have anybody that was on PTO or layoff or furloughed, unfortunately, how are roles assigned within the departments, and how interchangeable are they? So always having possibly some backups. It can be complicated, but now is definitely the time to get those things down. Let's think about
it's absolutely critical. Sorry, Jeff. This is absolutely critical to the role side that you mentioned with staff that are coming in and out, given the current environment. to not be reliant on a specific individual, and that everybody understands what their roles are going to play in advance of when this next bump may occur. You don't have a crisis playbook to pull it out in the middle of a crisis and turn to page 46 and address it. It only works when the staff understand how it's supposed to work and are able to use it accordingly. So it's something to think through and prepare for the next phase of this.
I think our guest a couple weeks ago, I don't think it was last week, 2 weeks ago, Steve Taliano, who's head of marketing, communications, and public affairs at UC Davis Health. He had one, for example, tip that I thought was really smart, which is on his team, he had 2 people assigned specifically not to be doing anything related to the crisis and instead focused on positive stories or other stories and news that needed to be told and managed, because that way not everything is consumed by the crisis and you're still telling people other things that are important and sharing positive stories. So that might be something for people to incorporate.
You can't stop the good work.
Yeah.
Can't stop the good work that's happening across your health system and just only focus on that. That's something that we focus on before COVID with our clients as well. Like, the business still needs to be operating and you still need to be sharing from a marketing communications perspective. So I think that's spot on from Steve.
Let's talk about the next couple of weeks. We've got maybe many systems in the next 2 weeks will be opening their doors to more patients. It could be at an ambulatory surgery center. It could be at the actual hospital as well. Maybe some clinics. What kinds of things should communications professionals now be prepared for in this scenario?
Yeah, I know we've talked a lot about how rapid recovery is going to be needed from the financial side of the house to ensure that health systems are stable and able to kind of resume the volume that they need to survive longer term. But we also know that consumers are going to be hesitant to enter their walls, and that employees that may not have been on the front lines addressing COVID may be fearful, may need to learn new policies and procedures and those types of things. And so we're hearing from a lot of health systems about how they're kind of working to communicate with both internal and external audiences about how they're going to keep people safe and what new protocols are going to be in place. Some health systems are looking at some really, really big pieces, but they're also, narrowing it down to the very, very small logistical pieces, like how many people are going to be permitted in an elevator? How many people are going to be in an employee break room? How are we going to operate our cafeteria and food service for patients and for visitors? And so how we communicate about those either changes or new processes or protocols is critical, both when they're already inside our walls, but in an ideal world where we're reaching them in advance of them entering the system.
So let's just talk about that. The last thing you said, which is wayfinding and internal signage and the experience side. That is, if you're at a large health system, massive footprint, massive real estate, lots of elevators, lots of cafeterias, lots of hallways. That's a lot of signs.
Yeah, it's expensive. I mean, you're going to be spending a lot on printing costs, and it's logistically just to get those up is going to be a challenge. So I think working closely from a communications perspective and from a marketing perspective with your operational staff as early as possible. Just as we're having conversations with clients about the rapid recovery approach, we need to be having those conversations about how we're going to be communicating about specific changes that people should be expecting, especially as you mentioned, Jeff, that systems may be reopening in the next couple of days or may already be reopening or in the next couple of weeks. And so how we can make sure that there's no confusion, that we're trying to practice social distancing as much as possible once people are inside our hospitals, however realistic that is going to be. So that we can try to regain the trust of the general public that it's safe to come in for a procedure and to receive care.
What about employees switching over now, Ryan? We've just gone through this period of time where nurses, for example, have been just at the forefront, at least some nurses, of the most dire and difficult aspects of this, and really a source of information for everybody to know what's happening and what needs to change or what is so difficult. I think about the nurses that have to wear N95 mask as soon as they get on a shift and they don't take it off for 12 hours, and how thinking about wearing a mask for 12 hours, no matter what you're doing, could be hard. But now we've got another wave of employees that'll probably be coming on the scene. What do we need to think about for those employees?
Yeah, I think it's it's the training piece for those that may not be as familiar with mask use or some of the PPE requirements that maybe you required in a different service line that hasn't been used to it, whether that's a pediatric nurse or something along those lines. Jeff mentioned that when we talked earlier today. So I think using those that have been on the front line to share kind of their experience and how important it is, but also maybe it might be a little thing like how did they kind of get used to wearing a mask for 12 straight hours when they may not have had to do that. What type of short form videos can we be pulling together to share that with internal stakeholders on intranets and those types of places. And so kind of showing, being as open as possible about what to expect so that the expectations are managed before someone shows up to work and has to deal with that on a daily basis.
I like that. And the expectations, I would consider having a nurse that's maybe in a ICU and a COVID unit share a video on what other people might need to experience and understand, so that they can address some of the concerns directly. The other thing that I think coming the next couple of weeks, hopefully, and if it's not in your region, definitely worth talking to your operational leaders in your public health department is the need to get people vaccinated. The vaccinations have been delayed and put off because they've been told, of course, stay away from non-urgent reasons. But vaccinations are one of those things that we're going to feel in the next 2, 3, 4, 5, 6, 8, 12 months if people don't get them.
Yeah, the impact that has from a public health perspective long-term as well. Do we have outbreaks of measles or other areas or other diseases as a result? And so I think that's something that we definitely should be thinking about and finding ways to show the general public why it's needed and what to expect when they enter a hospital to have their child or themselves receive a vaccine.
So I think for health systems to consider a few things there. Are they going to have drive-through testing, or drive-through vaccination possibly? The communication then to patients about that, or if it is coming in, encouraging people, which maybe primary care, pediatric, you don't generally have to do that. People are pretty on top of stuff. So you may need to encourage people to come in. And of course, as we said earlier, really reinforce how them and their children are going to be safe. I read an example of one health system that they're doing well baby visits and just in the afternoon. And if you're sick, it's in the morning, so that they're desanitizing everything or sanitizing everything in between. So really, that's a different way of cohorting patients. Okay, so another trend, Ryan, that we have to be thinking about and possibly preparing for a little longer term, possibly, but still around the corner, and something for the comms leaders to think about: mergers and acquisitions.
Yeah, it's going to be a big topic, and we already had seen over the last couple of years kind of the M&A activity in the health system space increasing at a pretty rapid pace. It was down a little bit at the start of this year and at the end of last year, but I think this is only going to increase that type of activity, given the financial strain that a lot of the smaller health systems are facing. Ultimately, it may not be possible for them to either return to operations as they were pre-COVID, or even exist, and particularly in some rural communities. So we're hearing from some health systems that had delayed M&A activity prior to or after COVID hit, that they're ramping it back up and starting to prepare for potential announcements. But we're also seeing some health systems nationally that are publicly pausing previously announced M&A activity. So mergers that were previously LOIs were signed. They may be delaying the due diligence phase to see how COVID ultimately impacts their bottom line later on this year or potentially into next. And then finally, we've heard from some other health systems that are on stronger financial footing than others that may be using this as an opportunity to expand and to grow their M&A activity than they may have previously prepared for in advance of COVID. So how do we consider that from a communications and marketing perspective? Resumption of previously planned M&A activity in the COVID environment has to be done very delicately. It can't reduce the health system's ability to address the current challenges. It has to be something that is announced or talked about once systems are returning to normal, or that the impact is not as significant in their individual markets. And then from a reputational perspective, if you are the acquiring system, decisions to furlough or cut salaries can be a reputational risk. And are going to lead to some really tough questions if you had to furlough a significant portion of your staff or ask a significant portion of your staff to take pay cuts, why or where this money is coming from to make specific acquisitions. So those are some of the key considerations that we're working through, both from a timing perspective. When's the right time? We're seeing some systems that may be looking at this kind of lull after we get through wave 1 before wave 2 comes in the fall to potentially announce some activity. And then also considering kind of the reputational impact that may occur from internal stakeholders and external stakeholders based on how the system responded to COVID.
It just seems like another example of you have to examine everything from this point on differently. Even if you've done M&A before, and even if you happen to have a solid playbook there, if you're at a larger system that's done this, it's not business as usual.
No, and yeah, I mean, everything you're right has to be looked at in that lens. The tail on, even once we have a vaccine, is going to be long on this. And people are still going to be thinking about how a system responded during the pandemic to evaluate whether they trust the system for their personal care or the healthcare of others. And it certainly feeds into the M&A discussion as well on how acquiring or acquiree organizations are going to feel based on how the acquiring organization handled COVID as well.
Yeah, and if you are at a larger health system that maybe you think you might be a acquirer, and you're a communications leader, now is the time to think through how are you using some of the positive sentiment about your system and capturing that, maintaining that, and developing a strong public narrative about the leadership and your contributions in your region and community, and making that real and tangible. Talk to your operational leaders, talk to others, and figure out how to carry that momentum into the future that will really build that goodwill and strong reputation you need, so that when you do make moves like an acquisition or a merger of some kind, those are received in a positive light.
Yeah, we always talk about, how important key stakeholder groups when you have a major announcement on the M&A side, and you don't build those relationships in a week before an announcement or even a month before an announcement.
Yeah.
That work needs to happen. That happens over years, and it's just the same as what we talked about with what Steve from UC Davis talked about, is the need to share those good stories and build that goodwill in advance of something. That is ultimately the reputational insulator. You're going to insulate yourself from criticism if you've done the right things in advance of a crisis occurring.
Yeah. So with that, I think summing up today's session, take that breath, breathe in, exhale, but now get some part of your team and yourself thinking about these things and what's next, and make a plan. Start writing messages and materials, start talking to your leaders about where their position stands, and setting deadlines for getting the information you need to act and have your team prepared and your organization prepared. Think about if there's new relationships in the community you might need to make or strengthen, and get ready. Our jobs don't stop, and we're here really to help you think about what's next, so that when what's next hits, you're more prepared and able to move faster and more effectively. That's it for today's show. Ryan, thank you again for joining us. Always good to talk to you.
Happy to do it anytime.
And Chase, thank you for having me on again, and thanks for making it easy as always.
Absolutely. We'll see you tomorrow.
Okay. For everyone else on the show listening, please let us know if there's something you'd like to cover, posting in the Zoom chat or emailing Chase or ReviveHealth somehow. Remember to visit thinkrevivehealth.com/COVID-19 for recording of today's episode, and all of our content's there. You can also subscribe on iTunes. Please let others know in your organization and your teams that might benefit from the podcast, particularly now that we're getting to some of the things we talked about today. I think the more people on your teams that listen and understand this can really jump in and help faster. And to all you out there, hang in there, keep up the amazing work. Skills you bring as marketers and communicators are really critical in getting through this and really helping with your team, your organization, and your community get through this as well as we possibly can. So we'll be back tomorrow and every weekday until this passes. Talk to you then.